But my name is Brooks Ballard. I am with the Michael and Susan Dell Center for Healthy Living at the UT Health School of Public Health. And we are very, very excited to be hosting today's webinar with Dr. Krishnan-Sarin. And before we get started and I hand everything over, I wanted to do just a little bit of housekeeping. First of all, I want to let everyone know that this webinar is being recorded and an archive will be made available on the msdcenter.org website by the end of the week this week, along with a PDF of the presentation slides. Second, I'd like everyone to know that we would love to have your questions today during the webinar. You can feel free to type them into the questions box at any time, but we're going to hold off on answering those until the Q&A portion at the end of the webinar. Next, I wanted to make sure everyone is aware that we are having Dr. Krishnan-Sarin again give a talk tomorrow. It will be a completely different talk. This one will be hosted by our Tobacco Center of Regulatory Science on Youth and Young Adults. But even if you're not in Austin, you can join the talk and watch it live via our live stream feed. And there's the web address that you can find that feed, or you can go to texastcores.org to get that link. So now at this time, I'm going to hand it over to our moderator, Dr. Anna Wilkinson with the UT Health School of Public Health.
Good afternoon, everybody. I have the distinct pleasure of introducing Dr. Krishnan-Sarin this afternoon. Dr. Krishnan-Sarin is a professor of psychiatry at the Yale University School of Medicine. Her research is focused on developing a biobehavioral understanding of substance use behaviors in adult and adolescent substance users, with the goal of developing optimal prevention and cessation interventions. In the area of adolescent tobacco use, she's conducted qualitative research, including focus groups and surveys to understand patterns and perceptions of use of tobacco products, clinical trials to develop and test the use of novel behavioral pharmacological cessation and prevention interventions, and experimental evaluations of behavioral and neural predictors of use and cessation behaviors. Because of her expertise in youth tobacco use behaviors, she's contributed to the Surgeon General's report on preventing tobacco use among young people, and she also serves as a member of the FDA's Tobacco Product Scientific Advisory Committee. Dr. Krishnan-Sarin is also the co-PI of the Yale Tobacco Centers of Regulatory Science, and their focus is they take a multidisciplinary approach to understand the role of flavors in tobacco and nicotine addiction. And we are very excited to have Dr. Krishnan-Sarin here with us this afternoon, and she will be talking about emerging trends in tobacco and other substance use in high school students. Welcome, and thank you.
Thank you. Thank you, Anna, and thank you for the invitation to speak to your students today. So as was presented earlier, I'm going to tell you a little bit about our work in the area on trying to understand tobacco and other substance use amongst youth. And tomorrow my talk will focus more generally on e-cigarettes. So I encourage you to attend both if you can. So let me just tell you a little bit about how all this work is funded. This is funded through grants from NIH, and I have to put in the disclaimer that the funding agencies had no role in the design, collection, analysis, or interpretation of the data. And as Anna already mentioned, I'm a member of the FDA's Tobacco Product Scientific Advisory Committee and the PI of the NIDA-funded Yale T-Course. So most of you probably know that tobacco use, or specifically cigarette smoking, is one of the biggest public health problems that not only our country but the world has faced for a very long time. Between 1964 and 2014, over 20 million Americans died because of smoking, and it included a lot of non-smokers because of secondhand smoke exposure, and also babies who were exposed to secondhand smoke. Smoking is still the leading cause of preventable disease and death in the U.S. This is a list, and I thought this was important for us to understand since we are speaking about youth today. This list highlights some of the biggest health concerns amongst children. And you see some of the factors that you would have thought about, including childhood obesity, bullying, and so on and so forth on this list. But you will also notice that there is that smoking and tobacco use is on there. In fact, it's the fourth biggest health concern. And the third biggest health concern is drug abuse. So it's not just smoking and tobacco use, but we are also concerned about use of substances like marijuana and alcohol and a variety of other drugs amongst youth also. And the reason we are concerned about this is because the adolescent brain is known to be very sensitive to the effects of a variety of drugs, including nicotine, which is the active addictive compound in tobacco products. And we are very concerned that the exposure to these substances can produce changes in the adolescent brain and can also lead to long-term chronic disease and health risks. So I would like to also remind people that the issue of smoking has really been tackled head-on by a lot of different people over the years. This graph basically shows you how smoking rates peaked in the 1970s and 1980s, and how, because of a variety of public health endeavors that were put into place, including by the Surgeon General and by the FDA and a variety of other individuals, we have managed to, over a period of time, bring the rates of cigarette consumption down. And this figure, which I really like, highlights the timing of some of these public health endeavors that were when they were put in, and the effect that they had. And you can see that good public health prevention campaigns can really make a difference in terms of reducing use of a product. What I showed you earlier was amongst adult smokers. Now, you have also seen similar decreases over the years in terms of adolescent or youth smoking. This graph shows you the percent of students who report daily cigarette use by grade. And this is data from the Monitoring the Future survey, which is a yearly survey which is conducted by the National Institute of Health. And you can see here that the rates of cigarette smoking have been steadily declining over a period of time since the early 2000s. Now, unfortunately, though, like I said, it doesn't end there, because we are currently in a situation where the landscape of youth substance use is really changing. And I'm going to focus just on these three substances, but know that I could probably tell you a lot more about other substances as well. But I'm just going to focus on marijuana, e-cigarettes, and cigarettes today. Now, this graph shows you how, with the decline in, even though there has been decline in cigarette use behaviors over time, the rates of marijuana use behaviors have remained somewhat steady and maybe have a little bit of an uptake or increase. But you have this new player, which is e-cigarettes, which have become very popular with youth, and the use of these products has grown significantly from 2011 to 2014 on this graph, and even more beyond that. So what we really need to keep in mind is that in adolescence, very rarely are substances used by themselves. Most adolescents tend to use one or more different kinds of substances. So when you look at this changing landscape, you really start worrying about the introduction of products like e-cigarettes and wonder what it might do to the initiation, progression, and maintenance of other substance use behaviors. Is it leading to initiation of other substance use behaviors? Is it leading to initiation of tobacco use behaviors? Does it put youth at increased risk over a period of time of other substance use behaviors? So this graph, again, is from Monitoring the Future survey, and it shows you rates of marijuana use. And to repeat what I said earlier, you can see that the rates of marijuana use have remained relatively steady over a period of time amongst youth. This graph shows you rates of alcohol use, and even that, as you can see, has remained relatively steady, maybe showing a little bit of a decrease over a period of time. If anyone is interested in these figures, if you go to the NIH website, this information is all displayed, and these figures are freely available, so you can actually look at this data if you have a need for it. Now this figure shows you the rates of e-cigarette use amongst youth. Again, this is from Monitoring the Future survey, and this came out in 2015. And what this is telling you is that teens today are more likely to use e-cigarettes than cigarettes. Unfortunately, a very small percentage of teens really view e-cigarettes as harmful. They view cigarettes as harmful, but they are not so sure about e-cigarettes, and they believe that e-cigarettes are not as harmful. Now, that is not to say that that might not be true. However, we don't really have the evidence to clearly indicate that e-cigarettes are less harmful to youth who are initiating tobacco use with these products. These are some pictures which some of you may be very familiar with. There are all different kinds of e-cigarettes available on the market today, ranging from products which are are disposable, like the blue e-cigarettes, to the tanks which contain cartomizers and atomizers, and the tanks which can now be filled with e-liquids, which is what you see this individual doing in the middle picture. These products have really shown exponential growth over the past few years. They are projected to really exceed the sales. You see some of the sales figures and some of the projections by 2017. The sales are in millions of dollars. Now, I don't want us to forget some of the other tobacco products which also exist. Most of the work to date, when you look at monitoring that has gone on in our nation, has focused on cigarettes, because cigarettes are the products which people were very concerned about, and they had a lot of toxic effects. However, I'd also like to remind you that other than e-cigarettes, we also have a lot of other tobacco products on the market, like cigars and cigarillos. Little cigars, are basically a tobacco which is wrapped in a tobacco leaf. You have smokeless tobacco, and then you also have hookah, which also uses tobacco. So one of the things that we also need to do is to take into consideration the use of all these different products and try to see if we can identify what the patterns of use of all the different products amongst youth are. I'm going to take you through two research studies today. The first one is going to focus on understanding the relationship between marijuana, alcohol, and the multiple tobacco products that I've spoken of today, including cigarettes, cigars, hookah, blunts, as well as e-cigarettes. And the second study is going to, the first one is actually going to give you epidemiological evidence of how the use of all these products kind of goes together. The second study is actually going to focus on how some of these tobacco products are being manipulated to use other substances, which is, again, a very novel use of these products, which is highly appealing to most youth. So for the purpose of for these papers, that we used middle and high school focus groups and surveys in Connecticut. And we have been conducting this work in Connecticut high schools since 2013. We conducted a series of focus groups in high school, middle school, and colleges in June 2013. Following that, we have obtained 3 waves of data in November 2013, June 2014, and May-June 2015 from middle schools and high schools in Connecticut. We choose our schools from different district reference groups in Connecticut. District reference groups in Connecticut are developed based on the socioeconomic as well as racial distribution of the state. And the state is divided into 9 district reference groups, and we select schools from different district reference groups to participate in our studies. Now, that said, I also have to be clear that this is not a complete random sampling. We reach out to schools to try and obtain a random sample. However, we are somewhat bound by who agrees to participate in the study. So I would still call this a convenience sample for those of you who are epidemiologists out there. This is an important issue. So the first question we are going to focus on is do adolescents who use e-cigarettes and all these other tobacco products also use substances like alcohol and marijuana? For this particular question, we used a sample of 2,241 Connecticut high school students who completed these surveys in November 2013. They were obtained from 3 high schools, which you can see on the graph there. They were predominantly from Southeast Connecticut. They were about 15.6 years of age. Equal distribution of males and females, primarily Caucasian. We have less diversity, unfortunately, in Connecticut. So most of our schools are primarily Caucasian, and 14.9% African American and 9.1% Hispanic. The measures that we used for this particular study was we assessed current cigarette smoking using the questions during the past 30 days, how many days did you smoke cigarettes? And students could pick from a number of different choices that you see on your screen. And a current smoker was defined as anybody who had smoked at least 1 day or greater in the past month. A current e-cigarette, cigar, smokeless tobacco, hookah, and blunt user was determined using the question during the past 30 days, how many days did you use the respective product? And a current user was defined as somebody who used at least once in the past month. And current alcohol and marijuana use status was determined similarly using during past 30 days on how many days did you use alcohol or marijuana. And you can see some of the answer choices listed there. They could choose to say, I have never used alcohol, marijuana. I have tried it, but I did not use it in the past 30 days. Or they could pick the number of days that they used alcohol and marijuana in the past 30 days. And for this particular paper, we used only current users who had used marijuana or alcohol at least once in the past month. Our analytical strategy for this paper involved using latent class analysis. Latent class analysis is a statistical technique which can be used to empirically identify subgroups of participants based on similar patterns of responses. If you're interested in more details about how we did this, you can review the paper, which we should be able to provide the reference for you. And this particular analysis can be used to identify youth substance use profiles and see what kind of patterns go together. This was by multinomial regressions, where we examined what demographic characteristics was associated with a particular class membership. So I'm going to walk you through the results right now. This paper, as I said, is in press, and the first author is Megan Morian, and it's in Drug and Alcohol Dependence 2016. And this was the profile of the users that we had, of use behaviors that we had in this particular sample. You can see here that the adolescents who were using were not, there were a lot of kids, I'm going to show you this on a later slide, who were abstinent. So it's not like everybody was using. However, there was significant use, current use of substances going on, especially alcohol use. And the days that they used in the per month was not, 1 or 2 days, but it did trend towards being above 5 days for most substances. So as I told you, we did a latent class analysis, and when we looked at all the different models that and looked at the fit indices of the different models, we found that the 4-class model actually had the best fit. And I've highlighted for you the BIC, or the adjusted BIC scores, and these are usually what are used to determine whether the model fits and how well it fits. And the lower these scores are, the better, just to give you an idea. So we actually went with the 4-class model as being the best model that fit the data that we had. And these are the 4 classes that we identified using this data. You can see here that there is a class of abstainers who are all the way at the bottom of the screen. They don't use too many substances at all. There is a class of students who are what we have identified as being primarily e-cigarette and users. This is your the dark dotted line, and you can see on this that they primarily use e-cigarettes, and then they smoke. They also drink alcohol. They use some of the other substances as well, but that's not what they primarily use. What they primarily use is e-cigarettes and alcohol. And the dark line denotes the students who used marijuana and alcohol. And again, you can see on this graph that they used very little e-cigarettes or cigar, smokeless, and hookah, but they did tend to use marijuana, blunts, and alcohol. Now, I'll tell you right now that blunts are another form of marijuana. So blunts are actually created from taking cigars and cigarillos and replacing the tobacco that is in cigars and cigarillos with marijuana. And this is also a very common form, a common use of cigars amongst youth. And the last class of students used all different products, which is all the way the lighter dotted line. This picture, this figure gives you a little bit of a representation of what the different classes were like. And you can see, again, as I was saying earlier, there were a lot of kids who were abstainers, who did not use any products. The other classes ranged anywhere from 4.6% of the students to 6.9% of the students, but majority of the students in this sample were abstaining, which is good. And you can see some of the percentage of the actual current use of each of the substances by the different classes on this figure. Moving on to constituency, as I mentioned, we then conducted multinomial regressions to see, to look at a variety of demographic predictors, including age, race, to try and see who was in each of these classes. What our analysis showed is that all classes tended to have older students. So younger students were less likely to use substances. The e-cigarette alcohol class and the all products class tended to have more males and less African Americans. So indicating that it seems to be males and Caucasian students who seem to be using e-cigarettes and drinking alcohol. On the other hand, in the marijuana alcohol class, you had more African Americans and Latinos. And the marijuana alcohol class was also more likely to contain females, African Americans, and Hispanics when compared with the other classes. So this is one way that you can actually identify within your sample what different use behaviors are, and then you can use this information to try and understand who are the kids who are using these products. Now, why is this important? This is important for prevention programs. You can use this information to actually develop directed prevention programs at particular subgroups if you know that these are the groups who are using these particular substances. Now, the one thing I would like to say is, remind people is this is a Connecticut sample. We need to figure out if these findings generalize to larger national databases and larger national samples. And if that is indeed the case, then it definitely will give us some direction in terms of what groups to target for particular prevention programs. So this is just a summary of what I just said. I'm not going to get into it anymore, other than to say that we do need to understand the characteristics that might explain different latent class analysis membership and try to identify who these kids are so we can develop appropriate prevention programs. The second part of my talk is going to talk about, again, as I said, the changing landscape of youth substance use, but specifically focusing on the combined use of tobacco and marijuana. And as I mentioned, to date, we know of 2 products which can be, actually 3. Hookah can be used in the same way as well, but we primarily focused on understanding the use of tobacco products to administer marijuana. And we've done most of our work with e-cigarettes, but now we are also starting to do some work on cigars. So the question that I'm going to address in the next series of slides is, do adolescents use e-cigarettes to vaporize cannabis? Now, this is all the different kinds of products that you can get to use in e-cigarettes. You can get hash oil, you can actually get THC wax, and you can also get dried buds. And you see in that picture somebody inserting a dried bud into an e-cigarette receptacle. The participants for this particular for this particular study were 3,847 Connecticut high school students who completed the anonymous surveys in spring 2014. They were obtained from 5 high schools in southeastern Connecticut, and they were approximately 16 years of age and equal distribution of males and females. The measures we used for the study were, we defined lifetime cigarette use based on the question, have you ever tried an e-cigarette? And if they said yes, they were classified as a lifetime e-cigarette user. Have you, during the past 30 days, on how many days did you use marijuana or hashish? And you see the definitions there. We used past 30 days as our definition for this particular paper. And dual e-cigarette cannabis users were those who were both lifetime e-cigarette users and cannabis users. Then we moved on to asking them whether they had ever used e-cigarettes to vaporize cannabis. So the question we asked is, have you ever used an e-cigarette to vaporize or smoke marijuana? And if they said yes, they were classified as somebody who had used e-cigarettes for this purpose. Then we further went on to ask them, which of the following have you used to smoke marijuana? E-cigarettes filled with hash oil, e-cigarettes filled with a wax plug, or portable vaporizers which are filled with dried marijuana like a G-pen, or anything else. And these are some of the product use rates that I'm going to show you. There'll be three bar charts for each of the samples. The blue one will be e-cigarette use alone. The red one will be cannabis use alone, and the green one will be those who say that they are vaping cannabis using an e-cigarette. So you see here in the total sample, when you look at the total sample, only about 5% of the sample says that they were vaping cannabis using an e-cigarette. But when you start breaking it down based on whether they were lifetime e-cigarette users or lifetime cannabis users, the profile differs dramatically. Obviously, for lifetime e-cigarette users, all of them use e-cigarettes. 67% of them use cannabis also. So when we say use cannabis, we mean it could be cannabis in any form. It could be e-cigarettes, it could be more traditional ways of smoking marijuana or cannabis. And then the last one is 18% who say that they actually used an e-cigarette to vape cannabis. You see a similar profile amongst those who are lifetime cannabis users, but when you look at the sample who use both products, your rates of using e-cigarettes to vape cannabis are even higher at 27%. Then we asked them, as I told you, about the forms of cannabis that they had used, and I'm going to walk you through the different forms, which is dried buds, hash oil, and THC wax. And here you can see that amongst lifetime e-cigarette users, they tended to have used the dried buds and hash oil in their e-cigarettes, as well as THC wax. Similarly for the lifetime cannabis users. And the last set of charts is the lifetime dual users. These are kids who use both e-cigarettes and cannabis. We also examined some risk factors for vaping cannabis, and we found that older kids were more likely to use e-cigarettes to vape cannabis. Males were more likely to use e-cigarettes to vape cannabis. We did not see any particular differences by SCS. Those who were lifetime e-cigarette users were more likely to use e-cigarettes to vape cannabis, and those who were lifetime cannabis users were more likely to use e-cigarettes to vape cannabis. Now, I just wanted to show you this figure because I want to show you that this is, I realize again, this is Connecticut data and it needs to be replicated nationwide, but this is data from Monitoring the Future, where they actually are also starting to evaluate whether what substances students are vaporizing when they use e-cigarettes. And you can see there that this is data obtained in 2014, that marijuana or hash oil is something that students are reporting they are using e-cigarettes for. So, so I guess this portion of the talk basically states that rates of vaping cannabis using e-cigarettes were considerable amongst those who were e-cigarette users, cannabis users, or dual users of e-cigarettes and cannabis, and that the students seem to use hash oil and THC-infused wax primarily in their e-cigarettes, and males, I think this is a mistake. I think it's older students, e-cigarette users and cannabis users were most likely to vape cannabis using e-cigarettes. So I think this study also raises concerns about the ease with which e-cigarettes can be manipulated for purposes other than vaping nicotine. This, as I said, we are just starting to try to understand the use of cigars for smoking marijuana, and this is a data from a paper which is just recently in press, where we asked youth about their cigarillo use behavior. Cigarillos, as you all know, are the small cigars, and 40.3% of students said that they did not use this cigars as cigarillos as they came in the package, and they actually added marijuana to these cigarillos and smoked them. So this is another form of manipulation of a tobacco product for other substance use behaviors, which has been around for a while, and we need to understand it better to try to see how we can prevent or control some of these manipulations. So I'd like to end by thanking everybody who has helped with all these studies, and this is most of the work we do takes a village, and this is the village. And if I've missed anybody, I apologize, but happy to take any questions.
Thank you very much. That was fascinating. I learned an awful lot. Before
I just would like to toss out, we invite you to type your questions in the Q&A box, or the questions box on your screen. We'll take your questions here, and Dr. Wilkinson will be moderating.
So while everybody is busily typing their questions away for us, I had one question. I noticed that all of the surveys that you do are anonymous.
Yes.
How important do you think that is in terms of being able to obtain the data that you're getting? Do you think the kids would be, and the other thing I wanted to know is surveys are anonymous. Do the parents know the children are participating? So there is an informed consent process, and how all that sort of part of it went.
Sure. So we have worked with both the New Haven and the Connecticut school systems, as well as with our IRB for a long period of time. I really think when you're asking about illegal substance use, if you can keep the survey anonymous, it's a good thing, because your chances of getting valid responses are probably higher. We have chosen to use anonymous surveys, and what we do from an informed consent perspective is that our IRB has waived direct parental consent or permission, in the sense, so what does that mean? That means that we are not required by our IRB or by the school systems to have every parent sign a consent form. We do inform parents that this study is ongoing in the schools, and at least a month or month and a half prior to a survey being done, information about the study and what the questions will be, more or less in an informed consent format. You know, it contains these forms. Brochures contain everything that an informed consent would have. These are mailed out to the parents from the school, and the parents are told that if they do not want their child to participate, they should school and let them know by a certain date. And the school then, make sure that the children whose parents say they cannot participate do not participate in the survey. They are allowed to sit in the room and complete homework or do other things. But that's how we work this out.
Thank you.
Yeah.
Thanks. Do we have any?
No questions in yet.
Oh, we still don't have any questions from the audience. I have another question. I guess historically we have been able to do so little research on marijuana because funding, and I'm sort of slightly off topic, but it's difficult because funding is not necessarily available. Do you think with all of this sort of this new push, and as we're through the tobacco, well, it's not through the tobacco sets of regulatory science, we cannot focus on marijuana research, but it's clearly these products are being used for marijuana. Is there any chance that we'll see more research and sort of more dollars going in this direction?
That's a good question. It's a hard one because I'm not NIH, but I think if we don't study these behaviors and study how these behaviors go together, we are actually probably doing a disservice to the field because, as I mentioned earlier, kids who use substances tend to use multiple substances. We all know that adolescence is a period of high risk taking, high sensation seeking, and kids who are further along on the risk-taking spectrum tend to use more substances. So, when you study individual substances by themselves, I think it may not give you the appropriate, proper picture. Yeah. And I would certainly hope that there would be more funding available to study at least different tobacco products, which, we have never, as you know, the FDA and have the PAT, which has been collecting information on that, at least through the PAT study. We are going to have so much information that's going to be so rich on the use of multiple tobacco products. Now, of course, we also need to assess all these other substance use behaviors also.
And how they all lead.
How they all link with each other is very important to determine the profile of the participant who's potentially participating in all these behaviors, because like I said, our ultimate goal is to develop prevention programs. So,
and if they all co-vary, we need all the information.
Absolutely.
I think we have a question from the audience that I actually think follows along with this. And the question says, I was wondering if you have looked at whether e-cigarette use leads to subsequent marijuana use or vice versa from a longitudinal perspective.
We are looking at that currently. As you can imagine, these are not things that you can establish with a year or 2 years of evaluation because these behaviors develop over a period of time. We are conducting those evaluations, and I don't have an answer for you right now. But we will in the future.
Do we have any?
It turned out to be the same question.
Yeah, our next
as it was asked.
Our next question was the same question.
Well, if we don't have any more questions coming in, we would be happy to forward questions along if you think of them after the fact. But we also hope that people will be joining us tomorrow. We'll have another talk on youth and e-cigarettes. That'll be a really great experience, and we're going to be live streaming that. There's the website there, or you can go to texastcours.org to get the registration link and either join us in Austin or, like I said, stream online. And we hope to see a lot of people there, and I'd like to thank Dr. Krishnan-Sarin again for both talks, and we look forward to seeing everyone who participated on here hopefully around soon. Thanks so much.
Thank you very much.